Hello, my name is Dr. Harpinder Shevchenko. I'm from Smiles by the Sea Family Dentistry, and I'm here to answer some of the questions regarding dental emergencies or emergencies related to your dental health. So, one of the questions that I do get asked is what qualifies for a dental emergency? So, it could be various things. One of the things is if you're having a severe pain, which is throbbing, has not stopped for number of hours or number of days. So pain that is constant, throbbing. In other could be if you have a sudden swelling on your face. Other could be that if you have a broken tooth, which is causing pain, or even otherwise, if you have a broken tooth, it is a dental emergency. Another question that I do get asked is, what do I do if I lost a tooth? So very first thing would be definitely call your dental office, call your dentist. If you do not have a dentist, look it up, search on Google and start calling the offices and make sure you're able to get into the dental office as soon as you can. You can certainly keep the tooth which is broken, or even if it's a piece of a tooth, certainly keep it, take it to the dental office, and then the dentist will examine you, take necessary x-rays, evaluate your mouth, and then treat you based on what comes up in the examination. Another question that I do get asked is, can you treat a lost tooth in one visit? So it depends on what your exact situation and the condition is. Sometimes if you lost a tooth, surgeon is able to place an immediate implant, but that really depends on the situation. Again, we will be needing to take your x-rays, possibly do a 3D scan, make sure your bone is all right for that. So that is the best case scenario, that in certain circumstances, after evaluating your x-ray, evaluating your mouth, and possibly doing a 3D scan, if you've lost a tooth and all the conditions are perfect for the implant to go in, you could possibly be walking out with at least an implant, but not a full tooth in your mouth. One thing that could be done is, if the office has the ability, they might give you a temporary tooth that, which we call as a mini denture, which you can have it, you can take in and out. So those are the options for if you are missing tooth, if you lost a tooth. Some circumstances we are able to get your tooth in the same day. Another question I do get asked is, how do I handle a dental emergency after hours? So there are ways to handle a dental emergency after hours. First of all is that you definitely give the our office a call right away as you're experiencing the dental emergency. Make sure it's dental, not related to your medical. You want to check that it's just a dental emergency. Give our office a call and you will be prompted to reach one of the doctors, and if they are available, they will pick up the phone and guide you through what is the best treatment to do, what is the best next step to take. If they're not available, leave a message on their phone and they will reach out back to you as soon as possible. So that way we can help you with whatever your need is and making sure the right step is taken. Another question that I do get asked is, what can I do to manage severe pain until my appointment comes? So there could be different scenarios. If your appointment is, let's say, next day and you're experiencing pain at night, try to take any over the counter medication that you might have. Also, sometimes putting a cold does help. And also, sometimes, we have seen that patients laying down, they experience more pain when they're laying down. Obviously, it's not comfortable to be sitting over the night, but certainly trying to keep yourself upright does help in certain cases. Those are the tips that you could use if your appointment is coming up. Let's say this is night and you're seeing your dentist next day tomorrow morning. If your appointment is a few days out, certainly give our office the call so the doctor can evaluate you and perhaps prescribe you a pain medication, or it might be a antibiotic as well too. Other option is that you can go to the nearest emergency room and they might be able to help you with some stronger pain medication. So those are some of the things that you can do to manage severe pain while you're waiting for your appointment. I hope I was able to answer most of your questions about dental emergencies. If you have any further questions, please feel free to reach us out at 603-926-8827. You can also find us on our website too, www.smilesbythecnh.com, and you're able to submit an inquiry and we will get back to you. I hope this was helpful.